Welcome back to Well Scripted with Dr. Sam, guys. I want to welcome all you guys back and thank you for being here. I am Dr. Sam Rassoul, owner and chiropractic physician of Align Chiro Care, and I want to welcome each and every one of you guys back to podcast number 4, and we're going to be talking about healthcare versus sick care. America's dilemma. I am fortunate enough to be having my main man. You guys heard his voice. You guys have seen his pretty face if you follow him on Instagram. One of my good friends, a very knowledgeable individual. Assad, go ahead and introduce yourself for those viewers who don't know you.
I'm Assad, and I'm here to offer what little I know about this industry. But I've been around the healthcare industry my whole life because my dad is a surgeon, and my family are all doctors, like internists and all that kind of stuff. So I've been fortunate enough to be around that since day one. So I've seen it from the outside view, and hopefully in a few years, maybe from the inside. So
fantastic, guys. If you guys aren't following this gentleman, Assad, please do yourself a favor. He really practices what he preaches. You have a lot of healthcare practitioners out there. I love it. Nothing against them. They give great advice. But listen, whether you want to believe in God, Allah, the universe, spiritually, whatever you want to believe in, you're given one body. The universe gives you one body. If that breaks down, you can't. It's not like a car. You can't get a new one.
Right.
So at least not now. Technology may tell us otherwise. But for now, take care of your body. So this guy, Assad, share with us your Instagram name for those.
Just Assad Shal, ASSADSHAL.
Fantastic. Thank you so much. And we're fortunate enough to be able to bring this information to you guys on a weekly basis. I'm fortunate enough to have Assad here with me. And this week, we're going to be talking about, as I said before, podcast number 4, healthcare versus sick care. And that's America's dilemma. Before we start, I just want to throw out a couple of stats. I'm a stat nerd, and I like to throw out stats.
Well, also, can you explain what that even means, the healthcare versus sick care?
Yeah, absolutely. No,
whatever
absolutely.
order you want to do that.
No, that's good. So as we get into it, so healthcare in this country, whether you're on, I don't care which side of the aisle you're on, whether you're Democrat, Republican, liberal, conservative, we have much to argue about. And it's much ado about nothing when it really comes down to it. And we hear that term, I'm sure you've heard in the news, healthcare reform. Well, it's not really healthcare reform. And we're going to talk about the difference between healthcare and sick care and what the differentiating factors are. But this whole concept of healthcare reform, do I believe we need it? Absolutely. But you knowing and targeting it is one thing, but actually going after the right enemy or fixing the right problems are another thing. So just a couple of stats out there. We talked about this in the podcast before about the opioid epidemic and the crisis going on in this country. But when you have 56 billion with a B, $56 billion a year being spent on opioids or pain medications in this country. 3.2 trillion, that's trillion with a T, $3.2 trillion per year are spent in healthcare in this country on healthcare. That's 10,000. If you average it out for 320 million people in the United States, that's $10,000 a person on average. And there's guys like Assad who takes care of himself, who eats right, does everything right. I mean, he probably doesn't spend more than 100, 200 just to get a checkup every year, myself included. I mean, if I go, I get my regular chiropractic visits, I get some acupuncture, I see my good friend nutritionist. I'm going to put her link down below as well, Galit Zarko with Eat Live Nutrition. She's phenomenal. But there are great nutritionists out there, and I advise every one of you guys to follow. I have, Assad's been nice enough to share his expertise in the gym with me, but I would strongly advise you guys to get a good personal trainer like him, someone who practices what they preach. But you're talking about the average per person in this country is $10,000 they're spending. So there's people that are spending $100,000 per year on the medical bills, and there's people that are spending next to nothing.
Yeah, in the States, yeah.
Absolutely.
I mean, in the States, one visit into the hospital could cost you $100,000.
Yeah, and I'm so glad you said that, Assad, because, 2/3 of all bankruptcy cases in the United States are healthcare related.
That's insane.
You think you're doing fine, all of a sudden, how many of you guys know someone, heaven forbid it's a family member, and they get sick or they have put out a stroke or heart attack or anything.
You have to resort to a GoFundMe page and have people pay for your. It's crazy.
So if you don't have a residual, you don't have an extra income sitting around the savings account, or if you do, and maybe you tap into the savings and you're saving it up for a rainy day. Well, this is not a rainy day; it's a thunderstorm.
Yeah.
Now you're struggling to make ends meet because of one catastrophic healthcare event. So, the couple of stats I wanted to share, and of course, the big one I love sharing with people. It's like when the United States comprises 5% of the world's population, yet we consume 50% of the drugs. 50% of the legal drugs, not illegal. I'm talking about legal drugs, guys.
Yeah.
Legal pharmaceuticals, and that includes 80% of painkillers. 80% of painkillers. And you would think, okay, well, at least we're doing something to stay ahead of the curve. We're trying to stay healthier. Well, the World Health Organization ranked the United States as 27th in health in the world. So something is wrong. There's a disconnect. If you believe, Albert Einstein said it best. What's the definition of insanity? Doing the same thing over and over, expecting
a different result.
A different result. Exactly. That's, and Assad said it best right there. You do the same thing over and over, you expect different results, and there are also ideologies that say you can't solve a problem with the same mindset you had when you created it.
Mm-hmm.
You have to change. If something's going on, you can't keep beating your head into the wall and say, I don't know what's going on. So something's got to change. So Assad said it best. And Assad, you're an athlete,
mm-hmm.
and I'm sure you have many doctors in your family, but the doctors in your family did something that most physicians don't do, and it's not the physician's fault. I really want to preface this before we go into this argument, guys. This is not an attack on any physicians. I have many medical doctor friends. I have chiropractic friends, physical therapists. They do the best of their abilities. Many of them do. Now you're gonna have good ones and bad ones, but this is more about the system itself.
Right.
And so, Assad, you grew up and being an athlete, and you had injuries and you had ailments and you had different things. And so you grew up, and what happened? If you got sick or you got injured, you would definitely take care of it.
Yeah, I personally am a hypochondriac when it comes to that stuff. So
Mm-hmm.
I would be running to my dad, driving him crazy every single time. I would feel like maybe a little lump or something that was off, and usually it was nothing. But that's how fast acting and in tune with my body that I was.
And you see, Assad said something really nice. I like what you said. You want to respond very quickly.
Right, because that we always preach the prevention rather than the damage control. So that I'd rather be over concerned and for my safety than under concerned and have to deal with it later.
There you go. He said it best, ladies and gentlemen, right there. If you heard it right there, the prevention. And I'm a victim of this myself. So don't think that I'm any better at what I do is. We're reactive. We're a reactive being. So we react to something. What's that lump, like you said, or I bumped, what's that bruise? I feel a little headache. I feel lightheaded. My chest is a little, like, I can't breathe as well.
Yeah.
It's reactive. We're reactive. Too many times in our society, we're becoming reactive beings when it's, we can be preventative.
Right.
If you wait for your car to break down to, before you need to get an oil change, it's going to be, that's the same
analogy. That's true. Like if you, like with dieting and the right vitamins and minerals and all that stuff, like that's you maintaining your car being in your body. And if you maintain it regularly, you won't have that catastrophic, engine failure.
Exactly.
And where it costs so much more. And sometimes you can't even fix it.
Say that C word for me one more time.
Catastrophic.
Catastrophic. I love the fact. See, this is why, ladies and gentlemen, Assad doesn't give himself enough credit. That's why I'm here for. I'm going to give him credit. He uses the words that really it just flows. Yeah. It resonates. These are the words I want you guys to think of. So let's go back to our definition, and we're going to come back to the C word he used, the catastrophic word. But sick care in this country, I want you to, if you're going to use word association, guys, this is simple word association. We are a sick care model in this country. I would prefer if politicians, if the healthcare industry would stop using the word healthcare, just say, yeah, we're sick care. That's fine. Because sick care is all about reactive. It's a reaction. You feel ill, you get injured, you go to the doctor. The doctor does one of three things. They either give you a prescription for a medication, they prescribe therapy to do, which is very good, or they give you suggestions. Go home, ice your ankle, go home, drink plenty of fluids, get plenty of rest. These are suggestions. This is what you're paying for. An expert analysis, and as they should be. But we're very, very reactive. What does this do? This creates a society in which we're symptom-based and system-centric. We're focused on the symptoms. I have pain in my ankle. I can't breathe well. I have a headache. I have chest pains. The list goes on and on. It's a reactive protocol. Assad said it best. I mean, even when he saw any kind of signs, he was quick to jump on it. But that's still, and I did the same thing. I grew up in that same model where we're very reactive. So pain is usually in chronic situations, pain's the last thing to show up and the first thing to go away. So I always tell patients, if you want to dictate yourself by pain, you may be up a creek without a paddle, you know, and up, you know, going the wrong direction. But we'll get to that a little bit. So how does that differentiate from healthcare? So healthcare is preventative care.
Right.
You're actually trying to promote health, so you're preventing disease. I mean, it makes sense. You're preventing illness, you're preventing disease.
Promote health.
Promote health.
Prevent sick.
There you go. So you look for the signs. And as I said before, you have to speak the body's language. That's why doctors get paid the money they do. Some do and some don't, obviously, in our society. But why do you think you are paying to go to the doctor? Because the doctor is, because of their years of training, they speak the language of the body. You can't have someone who's not trained. It's like having a conversation and you only speak Chinese and they speak Greek, and you're not going to be able to communicate. So what's happening is your doctor speaks the body's language. Look for signs. When this hurts, when I do this and this causes discomfort, I know this is wrong with you. And so you have to know how to speak the language. But even more than that, and I think I've posed this question to Assad before, and let's see how good his memory is. Do you remember what percentage of the nerves in your body are pain nerves?
It's small. It's like 10%.
10%. Yes, he got it. Ladies and gentlemen, that's it. 10%.
This is you. Like test taking 101. You have to get the answer wrong to get it right.
Yeah. But see, Assad answered it a couple weeks ago on our podcast, and I posed the same question to him, and very similar to the majority of people, he basically gave you the answer that it was 50 to 60%, up to 70% of your native.
Because I assumed pain was part of the sensory nerves. But
yes.
I guess I personally didn't know that pain was a completely different nerve in itself.
Exactly. So if you want to go more scientific into it, it's nociceptors or pain nerves. You have mechanoreceptors or motor function, and proprioception is sensory or positioning. Like that's why you can close your eyes when they do the proprioception test and touch your nose, the sobriety test. That's proprioception, knowing it, sensory feel, and everything else. But 10% of your nerve fibers are pain. That's why I go back to the whole thing, speaking in language. You've got to know as a physician, as a doctor, I don't care what initials you put behind your name, MD, DO, or DC. You've got to be able to speak the language. You got to look for those signs, whether they're having imbalances. And I use the word functional disability. Guys, if you think for 1 second that insurances, healthcare, auto insurances, whatever, personal injury, care about pain, they don't. Because you could take a pill to cover up your pain.
Right.
It's about functional imbalances. What can you not do or do as well as you could prior to you having this discomfort, pain, illness, whatever? So that's the big thing. And also another thing is, healthcare talks about gut health. There's a nervous system in your gut. People say, oh, you think with your stomach sometimes. That literally is a translation. It's like, oh, it's a saying. But there's a nervous system in your gut called the enteric nervous system. So you have two nervous systems that are constantly trying to yin and yang. The parasympathetic, which is your calming, and your sympathetic, which is your fight.
So is that why stomach pain is one of the worst pains?
Stomach pain, because it's a nervous system that's telling that it's a third one, and that's why
so potent.
It's so potent because it's telling the body, hey, listen, you want nutrients, because we get most of our nutrients through our food. So if your stomach and your rest of your body is starving for nutrition, I'm not telling you you're starving because you're eating a hamburger and French fries and ice cream and candy bars. It's making us not hungry. I'm getting hungry too. But these are savory foods. But you may be eating but getting no nutrition.
Right.
So you may start having stomach pains for one reason or another, but it's like your body is calling out for nutrition. And sometimes you're not even in pain. Again, we're going to go away from pain. It may not be pain. You may have symptoms like cramping. You may have symptoms like bloating. You could have symptoms that, oh, I must have eaten something wrong. No, these symptoms may be arising because your body's trying to tell you, you're not giving me what I need. And pardon my language, but the hell with it. I'm going to start giving you these symptoms. I'm going to start giving you cramping. I'm going to start giving you bloating and gas. And sometimes it can be not even related to the gut. It could be foggy head. You can't think. You're at work and you're like, what did I just read? Or did I see that memo? What would that memo say? And this starts to compromise your work capabilities. So, Assad said it best. What was that C word you said, Assad?
Catastrophic.
Oh, he said it so beautifully right there. Catastrophic. Guys, for all my listeners out there, they're tuning in. Health insurance is a big topic in the, I'm going to use the quotes again, healthcare reform. And so health insurance is something that is following by the same ideology that auto insurance is going toward. And let me use that as an analogy. So I want my listeners, I do this when I do my health lectures. Asad, you own a car.
Mm-hmm.
Okay, you have a car. And you have auto insurance, correct?
Right.
Okay, good. Some of the drivers out here in Miami do not, but as a good driver, you have auto insurance. Let me ask you a question. When was the last time your auto insurance paid for your tire rotation? When was the last time it paid for your alignment? What about an oil change? Did they pay for your oil change?
That's not covered.
That's not covered.
It only covers the crazy
stuff. Heaven forbid your brakes don't work and your car doesn't, you can't hit the brakes and you go off the street. Let's say you swerve because you're a good driver and you miss hitting someone, but you hit a tree, and then now your car's totaled. At that point, your auto insurance will kick in and give you a check to go buy a new car. That's that C word.
Catastrophic.
Catastrophic, ladies and gentlemen. Something catastrophic had to happen before, in this case, Assad's insurance, auto insurance kicked in to take care of his car. Why is it that we do oil changes? Why do we do tire rotations? Why do we do alignment?
So we don't get into those.
We don't get in those predicaments. You don't want your car to break down. Why is it in this country we treat our cars, which are, disposable, you can get another car if, heaven forbid, something happens, better than our bodies? We do the oil changes, we do the tire rotations, we do the alignments, yet we don't do that for our own bodies until they start to break down because we're like, my health insurance doesn't cover that. My health insurance,
health insurance is
a catastrophic. That is what it's going toward. Guys, I'm not even going to sugarcoat it. If you are waiting for your health insurance to tell you when and how you should live, you damn well better have some good life insurance because it ain't going to kick in until it's too late. It ain't going to kick in until it's too late because it's such a health insurance is about health insurance. It's about, catastrophic insurance should be called. Just like life insurance is about life insurance is about when you die, it's about death. So like saying by that token, you've got to make sure, don't let the insurance and what your coverage is dictate when and how you take care of yourself. That's a huge message I wanted to share because my main man Assad here talked about that C word, which I love. It's catastrophic. I love the way you pronounce that. So Assad, you're a smart guy. You obviously take care of yourself. Allegedly. You take care of yourself. You work out. You just came back from a shoot in Puerto Rico, which you were training like crazy for. You had to make sure you were on top of your diet. But that was being proactive, and that was awesome. You had to make sacrifices.
Like the thing is, for example, what I do is not necessarily healthy. Like if I did it for too long, the healthy part about it is realizing that it's not a sustainable thing, and I'm constantly cycling my nutrients and stuff. So obviously my profession is not for everybody. When I go and train people, I'm not training them to do the step on stage or train for a shoot or whatever. It's to be healthy. So I know the difference. Like I'm not going to tell somebody to go cut carbs for a week and that's not healthy for other people. So I'm doing it because I have a certain look to achieve. But when I'm preaching health, it's about balance.
It's about balance. I like what he said, guys. If you listen to Assad right there, he does one thing and he knows what he's doing it for, but he's not. And I want to stress this to you guys. If you look at his pictures on his Instagram, you're going to see a guy who doesn't have like an ounce of fat on him because he sacrifices and puts himself through hell in a handbasket because he puts in the work, he puts in the time, but he doesn't crash diet. He's not about the crash diet.
It's a long term. First of all, if you're already in shape, you're not going to have to crash diet.
There you go.
If you stay in shape year round, you don't have to do it.
Yeah.
Also, if you give yourself enough time in advance, like let's say you don't work for a month and you have your next thing is to, this is a very specific, this doesn't pertain to everybody.
Yeah.
But you train for a month and you do it slow, so your body can adapt over time.
You can adapt over
instead
time.
of trying to cut water in like 3 days or something like that, where you starve yourself or cut water completely, which I hear people do, or diuretics and all these crazy things that you can do.
You can do those crazy things. They'll give you the results. Yeah, it's not healthy.
You look great. As we said, it's a Ferrari outside and a Model T Ford inside or something.
I like that. You know, you're dying on the inside. You cannot truly be healthy if you're dying on the inside, guys. So Asad was a great example in his line of work in fitness, and he's talking about how he preaches health to his clients.
Yeah, I'm not gonna. That's a lot of these personal trainers, like will tell their clients what they do, right? Mm-hmm. And they give them that, and you're not going to train a 50-year-old woman the same as an 18-year-old athlete. You know what I mean? Yeah. Like, it's just not, these cookie cutter programs give me, like, I get so mad about them.
Well, I mean, there's people that are probably hypocrites too. There are trainers that like look great, but they're using different performance enhancing drugs that see their look, and then they're eating McDonald's 3 times, 4 times a week, and they're just like, you're feeding your body, pardon me to say it, but you're feeding your body crap, and you're expecting to have that Ferrari inside and outside. So going into it, I mean, this is what I wanted to preach to you. It's the fact that Asad kind of preaches how he practices what he preaches, but he helps people live that healthy lifestyle. By the same token, you've got to be able to listen. Every patient that walks through my door, regardless if they stay or not, they are entitled and they deserve to get your best, 100%. I never try to put my ideologies onto a patient.
But you have to be personal. You have to take you're not going to say the same thing to every patient. It's like saying, somebody has back pain and you like massage their ankle or something.
Yeah, exactly. Like, you're not going to do the same thing for everybody else. You're not going to do the same thing. I cook on. I love that. You're not going to cook on. You're going to be specific for everyone. So in my office, and this is what I want you guys to really understand, if you're going to any therapist, you're going to a chiropractor, you're going to an orthopedist, you're going to and I'm kind of focusing on the musculoskeletal because that's aches and pains. I'm talking about aches and pains. So if your body aches, you have neck pain, shoulder pain, knee pain, ankle pain, you've had discomfort. Maybe you don't have any pain anymore, but your ankle doesn't feel right when you jog. Maybe your shoulder just kind of doesn't, give you that when you sleep on it, you kind of tweak it a little bit. You're like, I feel numbness in my finger. This is what I go back to, speaking the right language. So again, when you have these kind of symptoms, something is off. I've used that word. Something is off. And you come into, let's say, my office. What I do is I do a full, thorough examination on a patient. I do a consultation in which I discuss with them things that, drawbacks they have. And then, of course, we do a full examination. During the consultation and examination, what I like to do is I like to make sure, like, what are your goals? Some people just want to be able to not have the aches and pains. Mm-hmm. Some people want to get back in the gym. Some people want to be able to lift their grandkids. Some people want to be able to play with their dog without having to have, like, knee pain every time they jog, like after their dog, and trying to have them outside to, use the bathroom. Mm-hmm. These are the third thing. Some people just want to be able to look at the computer screen and not have a migraine every time they do it. So you have to know your expectations. So I urge every one of my listeners, go to a doctor who is willing to listen. Because if they're listening, you'll know they're listening. Because if you tell them that, and then they just give you something, and they're just like, I did whatever this, they're not really listening to you. So the biggest thing is I do something in my office, it's the 3 R's of my healthcare program. It's relief, repair, and rejuvenate. Yes. And I never try to push my ideology on anybody. I say, what would you like? Phase 1 is pain relief. So in phase 1 of pain relief, if you're going to a physician, really assess yourself. If you, for those of you guys who are out there and getting care right now, or which phase are you in? Has your doctor even discussed this with you? Pain relief. The number 1 goal of pain relief care is that you want to decrease inflammation. So you're inflamed. Something is causing inflammation. So you want to decrease inflammation. How do you do that? You're going to have high frequency of care. So maybe coming in 3, maybe 4 times a week for therapy or session with a chiropractor, or physical therapist, or an orthopedist, or so on and so forth. Or you're doing stuff at home. There can be home care protocols. So again, if you have a doctor that knows how to help you out, so you can do stuff at home. But the number 1 goal in the pain relief phase is to decrease inflammation. So you need to do it frequently, but the duration should be short. Be really wary, guys. Again, I don't want to, talk ill toward my profession, and I know Asad doesn't want to do either for fitness, for people in his fitness realm. Sometimes he wants to. Sometimes I do too. Yeah. But really, you should have like hurdles. You should have like checkpoints. You should have like, okay, let's get you, after 4 to 6 weeks, let's get you from, stage 1 of the pain relief phase. And then you graduate or you hit your checkpoint. And at that point, if a patient says, I just want to get out of pain, okay, then that's all you do for them. Mm-hmm. And then what they do is then if the pain comes back, they come back and see you. I call it the hamster wheel of healthcare. Listen, there are plenty of people that want the hamster wheel. They just want to jump on it when they're in pain, get out of pain, they're off of it. But a lot of people start in phase one, they feel so good, they want to go to phase two. They're like, you know what, doc, what you talked about with me, I want to repair. And that's the most crucial stage, tissue repair. And I feel that, and I know people can argue with me, pain relief is more, rejuvenation is more, but tissue repair, you're actually fixing the problem. You're bringing better range of motion, not a Band-Aid. I've seen you in the gym, Asad, when you train your clients, you're not only talking about strength with them, you've talked about mobility, form, flexibility, range of motion. These are the key words. If you have a trainer, guys, you need a trainer like Asad who actually talks about, hey, your flexibility needs to increase.
Yes,
I noticed
all of that is what? Preventative.
Because
you won't injure yourself.
There you go. Exactly. You do stuff now, I always tell my patients, invest now or pay later with your health. You're going to invest now in your health, or you're going to pay for it dearly later, because the bill's going to eventually come. So you really want to make sure. So when you're in the tissue repair phase, you're coming in less frequently than you would for pain relief, but you're doing more stuff at home. You're working in conjunction with your doctor. You have a good trainer, like someone like Asad, a good trainer to help you out. You have a good nutritionist, someone to put you on a care plan that make you eat the right food so you're not inflamed as much. Mm-hmm. You're actually trying to repair those tissues, and you're actually starting to promote your health. And at that point, when you're increasing range of motion, getting better movement, basically mobility, everything is starting to come into fruition, you start to feel, and you're already feeling good. This stage, guys, I call it the danger zone, because people feel good and they stop doing it. They slack off. Yeah, I'm fine. This is the stage I call you the danger zone, guys. If just because you're feeling good, take the recommendation of your doctor, take the recommendation of your trainer. They speak the language. They're looking for those drawbacks. Don't let your drawback set you back. Mm-hmm. Get ready for that comeback. Oh shit! And then hey, listen, we dropped the bombs, baby. It's all good. But don't let that happen. You don't let a drawback set you back. There is that comeback, and listen, the comeback, and you can go up and down the roller coaster and come back here and there. But if you're consistent with it, you don't have to prepare for it. Like Asad said, if you stay in shape all year, if you eat the right food, if you get active, it doesn't take it's not like the New Year's resolution people who are like, oh my goodness, I put on this much weight. Asad keeps in shape all year round.
It's not a fad, it's a lifestyle.
There you go. It's a lifestyle. It's a lifestyle. So the last phase, guys, and this again, if you're interested in it, and I know I fit in this mold, my friend Asad fits in this mold, everybody in our line of work really practice what they preach. They really fall in this realm. So you do phase one, you do phase two, now you're feeling great and you want to continue feeling great, and you do the rejuvenation, or I call it maintenance phase. And the maintenance phase of healthcare is when you're just maintaining that good health. You're staying consistent with your diet, you're staying consistent with your exercise, you're staying consistent with your chiropractic visits, you're staying consistent with your XYZ. Healthcare promotion, disease prevention. I know, Asad, you do that all the time. So
that's right.
Yeah, no, you try and
stay humble. I don't have my dad in the other room.
But Asad does it, guys, when you have someone like Asad who really practices what they preach, and that's something very, very crucial and very important. So the most important thing about the maintenance phase, guys, is we talked about the range of motion and mobility in your tissue repair. But rejuvenation phase, two key words: optimal function. Optimal function. If you are trying to promote optimal function is defined as whatever organ or whatever tissue or whatever system functioning at its 100% capacity. I don't think you could pick one person on this planet. It's actually like my heart's working at 100% of its capability, or my brain's working at nothing. So you're always striving for that.
Yeah,
but that's
optimal perfection.
Pursuit of perfection, pursuit of optimal function. And how do you do that? Well, you have to, what controls everything? If I were to, I'm looking at Asad and I raise my arm, or I blink my eyes, I'm not even thinking about blinking my eyes, but sometimes I can, but I raise my arm, that's the nervous system controlling everything. So because you are on a maintenance plan, you're enhancing the nervous system function, you're going to live a healthier lifestyle. You're letting the channels, like the circuit board of your body, run and the close to optimal function as possible. Mm-hmm. So that's why, And Assad and I have spoken very in depth when he comes into my office because, I mean, you see this guy in the gym, he puts himself through hell, but he takes care of his body because he knows
Yeah,
that
like
it's gonna,
you have to like if you're on one side of the extreme, right? You have to go to the other side of the extreme to balance that out. So if I'm killing myself at the gym, I'm gonna have to supplement that with amazing dieting and like rehab, not rehab, but like listen, if I'm sore,
yes,
I'm not gonna go hit that same body part the next day. I'm gonna let it
you're
recover.
gonna recover.
Do whether it's a sauna or massages or anything that will help me
Absolutely.
recover. So
Absolutely. But
gotta be smart about it.
everything we do, also, it's interesting because you think we talked about some numbers with the $56 billion in opioids and $3.2 trillion in healthcare. But I mean, we haven't even talked about the other industries out there. I mean, think about how many people are suffering with digestive health. They're like, I have indigestion, I have IBS, I get constipation, I get this, I get that. How many digestive issues out there? How many people in this country are buying anti-aging cream because it says anti-aging on it?
Yeah, that's
If
all
you
BS.
are maintaining your health, guys, you are anti-aging.
Drink more water.
Drink more water, maybe less sugary
Yeah.
drinks. You watch what you eat, what you put in, what you get out. And I tell patients all the time, you want to know how your body responds, whatever you eat, 21 days later, it'll come out through the skin. So sometimes people are like, hey, why am I breaking out? Because what you had 21 days ago, your body may have responded poorly to it. So really being consistent, that's why you can't just be like, oh, unless you have an allergic reaction, you break out the next day. But anti-aging, think about that, guys. Anti-aging, if you actually take the time to maintain your health, you're running more
it just
optimally.
doesn't make sense because you're gonna age.
You're gonna
You want to, instead of anti-aging, maybe more like age gracefully.
age gracefully.
Yeah.
There you go. You see how like sometimes like I get off on my soapbox and Assad's like, listen, man, we gotta bring you back down. They say the right words. Say the right words. Aging gracefully, because you can't. Of course you're gonna age. You're gonna age. But I love what he said. You're gonna age gracefully. Listen, there's a huge difference between some 80-year-olds I've seen that can barely walk, and unfortunately, they're just like they have walkers and everything else, and then there's 80-year-olds that are running marathons.
Yeah, I just saw it on Facebook. It was like 89-year-old deadlifting 4 reps, 405 pounds. 89 years old.
It's
crazy.
And so age is nothing but a number,
Yeah,
guys.
man.
Age is nothing but a number. You want to make sure you age gracefully.
Yeah.
So that's how maintenance. So the role of a healthcare professional, regardless of what initials they put behind their name, is number one, listen to the patient or listen to your client if you're in the personal training realm. Listen to what your goals are. You should have someone in your corner who understands your goals. If your goals are to lose 10 pounds, they're going to put you on a certain regimen. If your goal is to stop having those headaches, if your goal is to XYZ, fill in the blank, they should listen. And then they should take that and they should actually do an assessment or an exam. In Assad's field, he would assess what is your baseline right now. He has to know where you're starting from.
Right.
You have to have something to compare to later on. If we put you on a 4 or 6 week program, so for me in my office, I do a full thorough examination because in 6 weeks or 4 weeks or 2 weeks or whatever I prescribe to do, we're going to reassess you. We need to know where you came from. Progress, exactly. And number 3, you advise accordingly. Whether you're a trainer, a nutritionist, a chiropractor, whatever, fill in the blank, you have to advise correctly and hold your patients/clients accountable. They deserve that. You want to be their friend, you want to be nice, but don't shortchange them. Share with them your knowledge, help hold them accountable. They'll thank you immensely because you held them and you knew that they could be better than what they were.
Right.
And I'm sure you've had that all the time with your clients. Absolutely. So the big thing, guys, when you look at it is which model do you want to be a part of? Do you want to be a part of a sick care model? It's very reactive. That's going to drive up your healthcare, your personal healthcare costs, and the country's, which is going to leave you in a detrimental state, which is going to leave you frustrated, which could leave you bankrupt, as we talked about. Or do you want to be part of a healthcare model which promotes health, prevents disease and illness, and helps you live a healthier lifestyle because of the investment you make today to have you pay less tomorrow?
There you go.
I mean, if that's simple, guys, It's very, very simple. I strongly urge you, if you have any questions, contact myself, contact Assad. Assad, share with us your Instagram name one more time.
At Assad Shal, ASSADSHAL.
Fantastic. And if you guys like to give me a follow on Instagram, I do Dr. Sam's Healthy Hints. They're daily 1-minute videos, just some healthy hints about how to live a healthier lifestyle. If you have any questions, you can always DM me. My Instagram name is at Dr. Dr. Sam, S-A-M, Miami, Dr. Sam Miami. So you can go ahead and send me any questions you may have. I want to thank each and every one of you guys for listening. This has been podcast number 4, Healthcare versus Sick Care, America's Dilemma. Not really a dilemma, though, if you really think about it. Asad, I want to thank you so much for being on the show as well.
Anytime.
Thank you so much, guys, and have a wonderful day, a wonderful week, and let's make 2019 the best yet.